Hi, welcome back to Rapid Regional Medical Center's The Dish on Diabetes. This month's topic is hypoglycemia and the 15-15 rule. So if you've never heard of the 15-15 rule, it is a rule on how to manage hypoglycemia, or a designated plan, if you will. The first step is, if you start to experience any signs of hypoglycemia, dizziness, agitation, pounding headaches, blurred vision, a throbbing, pounding headache along with nausea, or a sudden cold sweat. So in other words, you touch your arm and it's cold, but you're just sweating profusely. Those are all signs of a low blood sugar. So how do you handle that? First things first, if you are driving, pull over on the side of the road. Call 911, tell them you're a diabetic, and look for the nearest road marker or location or somewhere where you can tell the 911 operator where to send help to you. That's first and foremost safety. The second thing is take out your meter and check your blood glucose. For a type 2 diabetic, your blood glucose level can sometimes drop the hypoglycemic episode. So if you check it and it's below 70, you need to eat a 15-gram carbohydrate. Then wait 15 minutes. Then you want to recheck that blood sugar. If the second blood sugar is still below 70, you want to eat another 15-gram carbohydrate and a little bit of protein with that, while you're still awake and alert, and wait 15 minutes. Then you want to check it a third time. So if it's still below 70, 1, you call 911 if you haven't done so already. 2, you go ahead and eat another 15-gram carbohydrate and a 15-gram carbohydrate with a little bit more protein than last time. And then wait 15 minutes and recheck it. If your blood sugar starts to go further, you can eat whatever you have there with you. If it doesn't and it starts to rise, once you feel okay enough to get up and walk, you need to go and eat a full meal, a balanced meal with carbohydrates, proteins, and a little bit of fats in it. So a protein, fat, and carbohydrate is considered to be a balanced meal. And then wait a little while, about 30 minutes to an hour after eating, and then you're going to want to recheck your blood sugar again. It should have stabilized to a normal level for you. The other thing is, suppose you're the diabetic and you start to feel very, very weak, dizzy, you start to have that hypoglycemic episode, and you can't reach the things that you need, your meter, anything like that. You need to call or notify the person that is nearest to you, be it in a supermarket, you have a fellow shopper, you're in church, your church members, you're at home, your spouse, your grandkids, your children, whomever. Get somebody there to go and fetch your meter and go and fetch a 15-gram carbohydrate and protein. Some examples of a 15-gram carbohydrate are 4 or 5 crackers, saltine crackers. It can be a couple of peanut butter crackers. It could be a small thing of Jell-O. It could be 2 to 4 ounces of orange juice. Another thing is 4 to 5 vanilla wafers. You just want to get something that has a little bit of carbohydrate and then combine that with a little bit of protein, which would be a cheese stick, a tablespoon of peanut butter, natural peanut butter, not any added sugars, a boiled egg, a couple slices of turkey breast rolled up, just something that you can get in with that 15-gram carbohydrate to stabilize, bring up and stabilize your blood sugar. And once you do that, I would take that reading and I would document it in my little journal, and then I would bring that to my next appointment. If you have more than 3 hypoglycemic episodes in a week, you need to notify your physician. And please, if you are driving, do not attempt to drive yourself to the hospital when you're having a hypoglycemic episode. You can lose consciousness and become a risk to not only yourself, but other motorists on the highway. So remember, stay healthy. Thank you for attending. Bye.